could be. So this is my number 1 or 2 question of the week. Do we have any idea when we can get back to normal life, Crystal asks. So when I have tough questions like that, I always take a second to think. And the story is, I think the new normal is not going to be like the old normal. I really don't think that the idea that you'd go and hug and kiss a bunch of people at a family party is gonna be normal for a long time. We visited France last year. It was a great trip, but everybody there hugged and kissed and whatever. I don't think we're going to get back to that for a long time, at least until we have a vaccine for this. But can we get away from the stay home, don't work, high unemployment that we have now? And I think the answer is yes. When? I don't know. I think I looked at this carefully today, and I think there are going to be 4 things that we need to have. First is we need to see this virus going down really dramatically and staying down for a while. I think in Oregon, the good news is that we've seen kind of a plateau. We haven't really seen it gone down yet, but once it goes down for a while, that will be the first thing you need. The second thing that you need is you need to have lots of testing with rapid turnaround time. So the testing we have now is okay. It's not that sensitive, hard to do, and the turnaround time can be very long. So sometimes it takes a week or more to get results. For us to really feel comfortable that we know what's going on, we have to be able to do a lot of testing. We have to have rapid turnaround time. And I think we need the antibody tests, also called serologic testing, so we can tell who's had it and who hasn't. So disease has to go down. We need to have rapid testing. The third thing we need to do is we need to build back the supplies of PPE. So remember, hospitals, starting in about mid-January, stopped getting supplies. And so most hospitals, even if they've not had any cases, are running out of PPE. That PPE supply will start again, but that supply will just keep them going. It won't build back their supplies. So we need to both build back their supplies and have enough for them going forward. And how much is a big area of dispute, but it's got to be a fair amount, because the concern is once we start opening things up and people go back to school and go back to work and whatever, we could see a surge in cases. And if we saw a surge in cases and we didn't have enough PPE, that would be a problem. And the last, which I've seen today in the news a lot, is we need an army of people to help track down these cases so that when we do find a new case, we can track down those contacts and test them very quickly and know who's infected so that we won't have these outbreaks. That we kind of already have in Douglas County. Most counties do not have it, but we've been fortunate to recruit some out-of-work nurses and nurse practitioners to help us on this. So we already have it, but it's going to be a long time for other areas in the state to get this done. So the story is